Signs of TB, tuberculosis, in patients. What is TB? Tuberculosis, TB, is a disease caused by bacteria called Mycobacterium tuberculosis. It primarily affects the lungs, but can also impact other parts of the body, like the kidneys, spine, and brain. TB is typically spread through the air. When a person with active TB coughs, sneezes, or speaks, he is releasing infectious droplets. Not everyone infected with the bacteria will develop active TB disease. Some individuals may have a latent infection, where the bacteria are present, but not actively causing illness. TB is curable with antibiotics. Treatment usually involves taking multiple medications for several months. What is the cause of TB? The primary cause of tuberculosis is the bacterium Mycobacterium tuberculosis. Tuberculosis is contagious, meaning it can spread from an infected person to someone else. This bacterium is spread through the air when an infected person coughs, sneezes, speaks, or sings. These actions release tiny droplets containing the bacteria, which can be inhaled by others nearby. Close and prolonged contact with an infected individual, especially indoors, increases the risk of transmission. What is the difference between latent TB and active TB? Latent TB and active TB represent different stages of tuberculosis infection caused by the bacterium Mycobacterium tuberculosis. Latent TB means TB bacteria are in the body, but they are dormant and not actively multiplying. People with latent TB don't feel sick and don't have any symptoms of TB disease. Because the bacteria are not active, they cannot be transmitted to others. In some cases, the bacteria can become active and cause active TB disease later on. Active TB, on the other hand, means that TB bacteria are actively growing and multiplying in the body. People with active TB experience symptoms such as cough, fever, night sweats, weight loss, and fatigue. Active TB is transmissible, meaning the bacteria can be spread to others through the air. When the infected person coughs, sneezes, or talks. In essence, latent TB is an infection without disease, while active TB is an infection with disease. What are signs of TB? Symptoms of active tuberculosis, TB, can vary depending on where the infection is located in the body. In case of TB of lungs, the most common symptoms include persistent cough. A cough that lasts for more than 2 weeks is a key indicator of TB. Coughing up blood or sputum. In early stages of TB, patient coughs up sputum, which can later turn bloody due to rupture of pulmonary capillaries. Fever of TB. TB patient shows history of fever for more than 2 weeks. Fever in TB is intermittent. Intermittent fever is a type of fever where body temperature rises above normal, but then returns to normal at least once within a 24-hour period. So, the patient has no fever throughout the daytime, and he has a low-grade fever, especially in the evening. Loss of appetite and weight loss. TB causes loss of appetite. TB patient also has significant weight loss without trying. Night sweats. TB causes excessive sweating at night, often accompanied by chills. Fatigue and weakness. TB patient feels tired and run down, even with adequate rest.